Linda McDonald. She's a registered nurse and the president of UNAP, here to tell us about the upcoming possible strike of nurses at Rhode Island Hospital. So first off, thank you so much for joining me today, Linda.
You're welcome. Nice to meet you.
You as well. So can you just start by giving us a little bit of overview of the situation?
The overview of today's situation is that the 2,400 members of the Rhode Island Hospital Local are voting today on whether to accept or reject the offer that is on the table from the Lifespan Corporation.
And when will that vote take place?
That vote is taking place all day today. We've had meetings. We have 6 scheduled meetings, as well as members come and vote on their way to work.
So we'll know by the end of the day if a strike is coming.
You will know by the end of the day. The last meeting is 8:15. I would think we'd be counting the votes by around 10 o'clock.
And if the measure is voted down, then the strike would commence on Monday.
If it is a reject, then the strike would commence Monday at 3 p.m. and it's a 3-day strike with a 1-day lockout, so we would return to work Friday at 3 p.m.
And so tell us a little bit of background. What led up to this? I'm sure this is months in the making. You don't just go on strike for all the time. What's led to the situation where we're at now?
The situation, we've been negotiating for several months. I am not at the negotiating table, so I can't give you specifics of that. But the members of this local do not take this action lightly. That's why we have what some people call an extra vote today. And the retaliatory nature of working for Lifespan and the removal of millions and millions of dollars, over probably $12 million from the negotiating table yesterday, has enraged the members that, once again, not only do they spend multi-millions of dollars on hiring consultants to tell them what their staff, if they really ask, could tell them, but now they have taken $12 million off the table, and we see this as a provocative and punitive measure for workers that are the backbone of taking care of patients every day. This is undisputed. These are skilled nurses, technologists, and therapists. And they really see Lifespan move to remove that money as a provocative move and has derailed these negotiations.
And so are all nurses at Rhode Island Hospital part of the union?
Yes, all registered nurses at Rhode Island Hospital, bedside caregivers, as well as respiratory therapists, diagnostic imaging, which is mammography, CT, ultrasound, surgical techs, are all part of the UNAP.
And so the concern that's come up a little bit is, Rhode Island Hospital is a massive hospital. Do you think they'll be able to keep up the demand for nurses and provide quality care to people who are there?
You know, Rich, that's a very good question, and I can only give you an example. On any given day, anybody who comes to the Rhode Island Hospital emergency room can see some chaos of taking care of patients. They're very sick when they come in. They're critically ill in some cases. Trauma rooms can be doubled and tripled. But there's an expertise of these emergency room nurses that they know where the equipment is, they know where the supplies are, they know how to talk to the EMTs, they know their docs. Whereas if you bring in replacement workers, as the hospital said they will, be staffing, that seems impossible. And I would say for patients next week to think twice about coming to the emergency room at Rhode Island Hospital.
So you believe that the care will be effective?
I think when you understand the level of care that these nurses and other health professionals give every day, that it would be impossible to bring in half the amount of workforce, not used to our charting, not used to any part of what we do. I think it's impossible, absolutely impossible, to think that they can give the quality of care that our nurses and health professionals give every day.
These are very, very strong words. And so when when was has there been a strike before?
No, there's never been a strike at Rhode Island Hospital, and I think that bodes for how carefully and how deeply we consider our actions and what we are doing today.
Absolutely, and it seems like this seems to be a growing issue. Just, I believe it was last year, there was the big nurses strike at Tufts. There have been teachers striking all over the country, so this isn't just a local issue.
I think it's probably not just a local issue. What is very clear to me is that some of the problems with a corporate healthcare model, which Rhode Island Hospital, Lifespan, which all the hospitals seem to be forced into, pulls away proper staffing. You've got to tighten your belt, but you can't tighten your belt by not giving adequate staffing, by supplies not being available, by having ancillary staff at bare minimum, and expect there not to be expectations of unionized nurses, at least, that when it comes time to negotiate a contract, and by the way, by Lifespan's own admission, they have put out in a statement last week that they have known that the Rhode Island Hospital UNAP members are under market valued, so to speak, and they have done nothing to correct that in all these years.
So even Lifespan admits that they haven't given enough, but they're still not willing to give more.
We cannot continue to be a training ground, bring in a nurse, train them, and due to the stress or the lack of competitive salaries, have them then leave and go to other states surrounding us. And this process has to stop. And we are looking for a fair and equitable conversation. We feel Lifespan has, is a punitive corporate employer in what they do, and they have not looked at what these negotiations. There was a survey of the employees done last February, and in that statement, the UNAP members and others, they admitted that they know that they are lacking in some of the issues that are being denied actually in the press.
So in a way, this strike isn't just for nurses, it's for patients as well, to improve patient care and make sure they can get the best care available.
As I said, to ask 2,400 nurses and health professionals to leave their patients is not taken lightly, and if we can improve the conditions at Rhode Island Hospital with a competitive wage and keep and train nurses, that will only help patient care.
Definitely. And is there anything else you'd want to share with the public about it? What would you say to someone who said, I don't really know, like, why should I support you? I don't really know what's happening.
Again, I hate to keep mentioning the amount of members that we represent, but they all have, most of them have families and friends and other relatives who understand, who see how hard they work, and I believe that they will support this action next week. And also, I do believe that we're hoping that the patients and their families that we take care of, that have relied on us and do rely on us every day, will support us in this effort and help us to get back to doing what we do best, which is to take care of patients. And again, this is the backbone of patient care at Lifespan or any hospital. And their actions this week once again show their punitive action of how they treat their employees.
And if the strike does go through next week, do you think that will be enough to convince Lifespan to come to the table and come to an agreement?
I think it will take some time. We hope to get back to the table. We hope to reach an agreement, and down the road we will have to decide what further actions we take if the attitude remains the same.
Great. Well, I know it's a very busy day for you,
It is
so
a busy day,
we'll let
thanks.
you get going. But thank you so much for joining us, Linda McDonald, registered nurse and president of UNAP. We should know by the end of the day whether or not there will be an upcoming strike at Rhode Island Hospital. So I know we're all keeping an eye out to see what happens. But thank you so much for
Appreciate you
joining
having
us.
me.
And that does it for us today. We'll be back tomorrow for our noon show, kick off the weekend a little early. And so here in the Navigant Credit Union Broadcast Center, I'm your GoLocal Live host, Rachel Nunes. Have a great day.